HealthRight is an organization that is based here in Nairobi but working across the country, and our focus is really expanding quality health care services to the marginalized communities.
Founded in 2005 in West Pokot, we began with a bold vision and an even bolder action, launching a pioneering HIV program that led to a staggering 1,000% increase in HIV testing across West Pokot and neighboring counties.
We really focus around ensuring that we reduce the gap in terms of health access between the general population and also the marginalized communities. And we have actually been working across 11 counties, focusing on a number of key thematic areas. One, reproductive, maternal, neonatal and child health, RMNCAH. We have also had programs in other thematic areas such as HIV and TB programming. We've done work around violence prevention, especially sexual gender-based violence. We've also have a thematic work around mental health across the areas where we have been working.
It has been an amazing journey working with HealthRight Kenya, starting from the initial project when they joined the mental health space. And our first project was a very amazing project because it was an area that has hardly been navigated through or have projects going on. That was on perinatal mental health, and this was happening in the informal settlements. So when you look at it, they are addressing an area that is neglected, and again focusing on women from the informal settlements, where we had amazing success stories from this project, and we were addressing depressive symptoms among pregnant and breastfeeding women.
Story yangu ilianza wakati mzee wangu alipoteza kazi, na mimi pia nilikuwa na mimba. Nilipata challenge mingi sana kwa sababu nilishindwa kulipa rent, school fees, na saa zingine pia kupata chakula ilikuwa ngumu. Na wakati mtu uko kwa situation kama hiyo, marafiki huwa wanatoroka, family members, unabaki peke yako. Nilikuwa najifungia kwa nyumba kwa sababu singetoka hata kwa majirani, kwa marafiki, sababu ya ile uoga, wanakusengenya, wanakuongea vibaya. Na sikujua kama na go through mental issues. Mpaka ule wakati HealthRight Kenya waliweza kukuja wakanitembelea, but mara ya kwanza nilikuwa naogopa open up kuambia what I'm going through. Wakakuja mara ya kwanza, ya pili, ya tatu, sasa ndio nilifunguka nikawaelezea, but walinipa tumaini na wakanipeleka through 10 sessions zenye ziliweza kunisaidia, na through those sessions niliweza kupata skills na nikajua kwamba hata kama mzee alipoteza kazi, bado kama mimi mwanamke naweza jituma na niweze kusimamisha familia yangu. Mimi nilianza kuenda kwa nyumba, nikafikiria, nikaona naweza anza kufanya nini ndio nijitoe kwa hii situation. Nikaanza biashara ya kuuza makaa, kuuza chapati, na nikaweza kuanza kulipa bills, watoto wakarudi shule, pia tukaanza kupata hata chakula. Currently I have an electronic shop. Pia niliweza kuhama kutoka kwa Salamu, saa hii nakaa nyumba mzuri. Nashukuru sana HealthRight Kenya, wamenitoa mbali, bila wao sijui saa hii ningekuwa wapi.
One of the key things that I must say is about the uniqueness of the work that we do, as an organization. We truly focused at the community. And we're really very keen around evidence-based interventions. As an organization, we co-create solutions with our communities to come up with key evidence that does inform the programming work that we have been doing for the last 20 years.
In our county, the challenge has been poor health-seeking behavior among men. We really appreciate that when HealthRight came, their focus was on this target population, which is men, because of their poor health-seeking behavior. And over time, we've seen increase in numbers of men who are coming on forward to seek for services, especially HIV test services. We really appreciate that in 2022, when testing services was integrated with mental health, we saw the community benefiting from mental health screening and referrals. We saw uptake of men coming in for seeking services, especially HIV test services, and those who are at risk being put on HIV prevention interventions, those who are found to be HIV positive being linked to care and supported through mental health integration, through psychosocial supports. And we really appreciate that this became a game changer in terms of HIV programming in the county and finding men and adolescents.
Naweza penda hii mpango iendelee na isiweze ikituachilia sisi takuwa ni kama tumeisha. Kwa maana tunapewa vitu paka kwa mlango kwenyewe. Imetusaidia sana. Wanabodaboda wenzangu nawaambia tuendelee kushikilia hapo na tusiendelee kutoka nje sana bila mpira, na ndio hii shirika nimekuja paka karibu inatupigania paka hapo kwa mlango. Sasa tusiweze kutoka nje bila mpira.
HealthRight Kenya is a very unique organization in the sense that the rights issues around equity, reaching out to people who have not been reached, creating health justice with its programming is the main thing that it does, especially in the areas of mental health, which is currently a very big issue in the whole country and in the continent and even in the world. A very neglected area of care is what HealthRight does. In addition, maternal health, sexual reproductive health, all the issues around non-communicable and communicable diseases, which remain a big challenge in our region, are some of the issues that HealthRight Kenya is tackling.
Andres, umekuja unasaidia sisi kabisa. Unajua vile kasi ya kina mama, anapeleka klini, anapeleka tena mpaka nafuata mpaka anapeleka hospitali. Mikindo hiyo shindomon abana mwanamke anasaa kwa nyumbani, anasaa kwa hospitali. Anaambia Andres, asanti. Na sisi anawana mabadiliko sana sana sana. Tangu akuje nasaidia sisi kabisa.
Appreciate HealthRight Kenya for what they have done in our county. From the time we started partnering up to now, they have really impacted us in a lot of things that we have been able to benefit a lot. They have been able to train our health workers, and they have mentored them to have skills. And our community health promoters, they have also helped us in training them and providing them with knowledge and information so that they are able to help our community right from our villages.
To this end, as an organization, we have been able to impact more than 4 million Kenyans across the 11 counties over the 20 years that we have actually worked. We take pride and we are really happy about the innovations, life-changing innovations that we have really seen across all our programs. When it comes to the sexual reproductive health space, we have also had very useful innovations. We did work funded by FCDO in Elgeyo Marakwet and West Pokot. The contraceptive prevalence rate in those counties was very low, as it were. But we had to come up with innovations such as male involvement, ensuring that we are doing social inclusion, innovations that ensured that we can penetrate certain cultural barriers and also address challenges both on the demand side and on the supply side to ensure that we can improve family planning in those counties.
Hapo mwanzo ilikuwa community ikisikia maneno ya family planning walikuwa wanaona ni kitu jambo hatari sana. Wanachukua kama family planning inaleta kanza, inaleta wamama kutokuzaa. Lakini baada ya HealthRight kukuja, tuliweza kupata hiyo information ambayo ilitusaidia, tukapeleka kijijini, kijiji waliweza kubenefit. Kwa sababu tuliweza kuwa na link nao kwa karibu, hiyo services ikafika kwa community. Of which tukakuwa trusted sana. Kwa sababu kuna wamama ambayo walikuwa wakienda na hofu. Wasee wao hawakuwa nakubali maneno ya family planning. Lakini baada ya sisi kupeleka hiyo information kuwa family planning haileti cancer, family planning haisuii wao kupata watoto. Inafanya nini? Inafanya tu child spacing. Mtu anaweza kupata watoto ambaye anahitaji ama anapata mtoto kwa muda fulani.
Wamama wamerelax, alafu pia wanazaa kwa mpango ulio mzuri. Maana hapa awali kabla wajue, mama alikuwa anazaa baada ya mwaka. Sasa afya mama inadhoofika, hata watoto ambao wanazaliwa pia hawana afya ile nzuri. Lakini sasa hivi baada ya miaka 3 ama 5, bila shaka yule mtoto akizaliwa, yule mwingine amekuwa mkubwa, afya mama naye ni safi. So kutokana haya mafundisho ambayo tulipata kwa HealthRight, mimi kama kanisa nilisaidika sana, na jamii wengi wamekuwa kipongeza na hata wanaulizia haya mafundisho yameenda wapi.
And it's so amazing these days when you go for support supervision and you find a community health promoter who is running these interpersonal therapy groups without being paid, and that shows that from what they did, there's a big aspect of sustainability.
I recall when we started with HealthRight way back 2018, 2017, when we were doing less than 40% prevalence for family planning services. But when HealthRight exited by the year 2022 to early 2023, our performance stood at 59% coverage for family planning contraceptive services in this county.
As we look ahead, we recommit to our core values: innovation, equity, and a human-centered approach, all in the pursuit of increasing access to care and increasing care quality.
I really wish to thank all the many partners. I celebrate the community health workers we work with. I celebrate the youth and the champions in universities that we have been working with. I celebrate the HealthRight staff who are the front line when it comes to programming within the organization. I appreciate the support we receive from our headquarters. Thank you, universities, for trusting to work with us to get solutions to the challenges affecting young people as well. To the Minister of Health, we also say thank you for creating an enabling policy environment for us to be able to roll out quality interventions that can be able to address public health challenges in this country. And for the county governments for being with us there during implementation, providing the technical support. We really appreciate that kind of invaluable support. To our partners, we'll continue working together, and everyone else that has really made these 20 years worthwhile. And last but not least, it's the funding community and our donors. Without the financial support that you gave us, donors such as USAID, FCDO, Gilead, Comic Relief, and several others such as Amplify Change that I may not mention all their names. Thank you so much for your financial support that came our way and enabled us to be able to support the lives of millions of Kenyans in terms of accessing quality health care. Thank you so much.